Thanks for tuning in to Vitality and Motion. Let this be a place to grow your mindset and prioritize movement. All audio is original with music and production support from Riverside as my editing platform. This podcast is for education and inspiration only, and any studies or products I mention are simply for context. Take what fits in your life and check in with your healthcare medical providers as you feel is necessary. Thank you so much. Hey everybody, welcome back to another episode of Vitality in Motion. I'm your host Maddie, and today we're going to be discussing vital signs, the normative values for those vital signs, why they're important, and then general exercise recommendations per the American College of Sports Medicine guidelines, and discuss some fitness devices trackers at the end. So let's start by defining what vital signs are and why they're important. Our vital signs indicate our overall physiological function, and it's kind of like the oil in our car that keeps us running. When the oil is low, the car will signal us to get it changed. Our bodies operate the same way. When something is wrong or we feel sick, the body notifies us, and it's not just all in our head usually. So this can be measured with things like basal body temperature, your heart rate, breathing rate, blood pressure, oxygen levels, and glucose regulation. And these are important because they are an overall indicator of our health and may help to detect an early sign of disease. I think these values are so important to be aware of and not something that you should just check once a year when you're at the doctor's office or when you're sick. I want you to be in charge of your health, so I think it's important that I share these numbers with you. And if you do find that these values are irregular, the good thing is that they are modifiable, meaning you can change these values simply through things like exercise or tweaks in your diet. Something that I wanted to note though is that if you do have any comorbidities or other disease factors like maybe COPD, certain infections, heart disease, or on certain medications, these values may vary for you, so always discuss with your doctor what these values should look like for you. Other factors that may affect these numbers could be if you're in a lot of pain, if you've had a lot of stress lately, excessive caffeine intake, dehydration, and even the time of day. So if you do want to be consistent with taking these values, I would say taking them around the same time every day is going to give you the most accurate results. And I feel like to start, a good place is to just check the values once a day, every day for like the next week, just so you can get a baseline or an average of where you're truly at. And then maybe from there you check it every 2 weeks or once a month or every 6 months. And obviously there's fitness trackers that can help you track these numbers. But I feel like when you truly understand the meaning behind the numbers, it gives more validity to it, and maybe you're a little more motivated to stay on top of these values. And therefore, if you are noticing a trend with maybe an increase in your blood pressure, there's something that you could do about it now before it's too late and you get an unwanted diagnosis of a disease that you could maybe prevented. So the first vital sign we're going to discuss is basal body temperature, which I know most of us are familiar with, but just to give a quick overview, the average temperature is going to be about 97.8 to 99 degrees Fahrenheit, depending on your body type. It can range. And most of us can feel when we're sick because our temperature rises, so this one is pretty self-explanatory. But a fun fact about temperature for females is that it's correlated to when you're ovulating. So you'll actually see a rise in temperature when you're in that phase of your cycle. The next vital sign we're going to discuss is your heart rate, which is basically the number of beats in a minute the heart contracts. Average resting heart rate is typically around 60 to 100 beats per minute. This can definitely rise when you're exercising, so keep that in mind. And to assess this, you're going to simply place your fingers, any one besides your thumb, because your thumb also has a pulse and you don't want it to get confused with the actual pulse, at the crease of your wrist on your thumb side. So fingers on the opposite hand, wrist crease on the thumb side. You will start to feel your heart beating, and once you feel your heart beating, you're going to set a timer for 30 seconds and count. After 30 seconds, you're going to multiply by 2 the number of beats that you counted in the 30 seconds to get the beats per minute. If it's not within the average of 60 to 100 beats per minute, maybe ask yourself, have you had excessive caffeine today? Did you just finish a workout? Are you on any medications? Because again, your heart rate can be affected by any of those factors. Next, we're going to discuss blood pressure. Blood pressure is the force of your blood against your arteries, which arteries essentially transport the blood to your heart as it flows through your body. Again, going back to the car reference, your heart is the engine of your body, and so we want to have a well-oiled machine to keep things running efficiently. With that being said, according to the American Heart Association, the average blood pressure should be less than 120 over less than 80 millimeters of mercury. The top number is known as the systolic value when the heart is actively contracting, and the bottom number is known as the diastolic value, or when the heart is relaxing. Again, if this is elevated, ask yourself those same questions you did regarding heart rate, And if you're noticing that the heart rate or the blood pressure is elevated on a consistent basis, it may be time to change things up or check in with your doctor to see what could possibly be the cause. And I will link those values below for elevated hypertension values, so keep a lookout for that in the show notes. And this is so important to be aware of because you could be more at risk for things like hypertension, where basically the force of blood is being pumped against the arteries is too much and your heart is just working in overtime. And it can also put you at an increased risk for any kind of other heart disease or stroke. And unfortunately, hypertension is a silent killer, so you may not even realize you have hypertension, and males are more at risk for females. So, if you're interested in exactly how to take your blood pressure, I'm going to have a step by step instruction guide at the end of this podcast episode. The next vital signs we're going to discuss is our breathing rate, or how many breaths you take in a minute. And this may be important to assess if you have maybe a lot of anxiety or you take a lot of rapid shallow breaths and you're just not getting those good deep breaths. Because when you're not getting those good deep breaths, this will affect your oxygen level to your heart and lungs in what we call a gas exchange of oxygen and carbon dioxide. And also, you're not engaging your pelvic floor as much, but that's a whole other conversation, and we'll definitely dive into that in a further episode. So anyway, the average breathing rate is about 12 to 20 breaths per minute for adults, and children may be closer to 20 to 30 breaths per minute. To assess this, you would have someone sitting in a chair across from you, just inhale and exhale as they normally do, and you would count their breaths in 30 seconds and then multiply that times 2 to get the average amount that they breathe in 1 minute. If you notice that maybe they're having an anxiety attack or they're taking those shallow breaths, a good tip is to teach them something known as box breathing, where you would inhale for about 2 to 3 seconds, hold that for about 2 to 3 seconds, and then exhale for that 2 to 3 seconds until you feel like their breathing rate is calming down. The next thing we're going to discuss is glucose. Glucose is essentially a simple sugar that serves as a main energy source for our bodies through things like carbs. If our body cannot regulate glucose correctly, that's when people are at more risk for diabetes. There's also been newer research suggesting that it can be linked to dementia as well. Essentially, poor glucose control can damage our blood vessels providing nutrients to our bodies. This is why there's been such a big focus on regulation of gut health and the mind-body connection. So most of the time when you do think of glucose, you probably think of diabetics since they check their glucose quite often or on a regular basis in order to function. But I think that this can still be useful information to see what spikes your levels, especially if you feel like you're more moody, fatigued, or in a constant state of being tired. I know personally I use an Oura Ring where they now are partnered with Stello to help track how it's affected during meals, activities, sleep, or stress. You also don't have to have an Oura Ring to use this Stello device. You can just buy it and download their app. So definitely a good resource to utilize if you're truly curious about that. To give you an idea of what the average glucose level should sit at before food, or a normal fasting glucose is typically less than 100 milligrams per deciliter. And then a normal glucose range when you are eating food is about 70 to 120 milligrams per deciliter. Again, these values will vary, especially if you do have diabetes, and as most diabetics are aware of, it is important to regulate so your blood sugar doesn't drop super low or get super high. Now, most of the time, these values that we did discuss with blood pressure, heart rate, glucose, they can all be modified with something like exercise or watching your added sugar intake or just eating more whole foods in general. But if you do find that any of these values are irregular for a long period of time, it's important to discuss this with your doctor or someone like a registered dietitian and nutritionist for further ways to help you regulate and manage these values. Now I wanted to transition to discussing the recommended exercise prescription according to the American College of Sports Medicine guidelines. So for any kind of aerobic exercise, specifically for moderate, they recommend about 150 minutes per week, which breaks down to about 30 minutes per day, 5 times per week. This could include things like a brisk walk, cycling, or swimming. Or you could do 20 minutes minimum of vigorous exercise, which could include things like running or high intensity interval training, and they say a minimum of 3 times per week for that. And then on top of that, whether you're doing moderate or vigorous aerobic training, they say you should also do a minimum of 2 days of muscle strength training. And then for adults 65 and older, they also recommend the same guidelines, except adding in balance exercises to reduce your fall risk, which honestly, I think anybody could benefit from balance and stability. It's not going to hurt you either way. But I always like to say movement is medicine. So any kind of movement is going to be beneficial for you. And maybe that's something like a movement snack where you do 10 minutes in the morning, 10 minutes during your lunch break, and then 10 minutes after dinner. And boom, you got your 30 minutes. And I don't know about y'all, but I always feel better after I take a walk. And sometimes, depending on the day, that's all I can get to. And it makes me just feel better that I got at least some kind of movement in. So I wanted to hit y'all with some stats just so it can kind of put it in perspective. Did you know that the CDC reports approximately 40.3% of the US population has a diagnosis of obesity, which then puts you at a higher risk for hypertension, high cholesterol, then in turn puts you at more risk for heart disease or stroke, as well as cancer. And then approximately 50% of people meet the aerobic recommendations and less than a third meet strength training guidelines. Now, that was directly from ACSM's site, but I just want to bring this up because I want people to prioritize their health now and not later or after a diagnosis of heart disease or stroke. It's important to invest in yourself now, and it's never too late to start. And as cheesy as this is, motion is lotion. So that's all I'll say about this for now, but you already know I'll probably talk about this a million other times on this podcast, so just be ready. So the last little bit I wanted to discuss was about device trackers, and I know most of us are familiar with the Fitbit and the Apple Watch, and they're great for tracking your steps and your heart rate, and it even has some cool features for sleep now, which is awesome. But not gonna lie, I mostly just wanted to brag a little bit about my Oura Ring. I've had it for about a year and a half, and honestly, I can say I love all the metrics it shows. It tracks all my vitals except for blood pressure. It shows my sleep, how fast it takes me to fall asleep, my stress levels, and how my body is just recovering in general with your heart rate variability. And so it's great for me to kind of be more in tune with my body. And the next day, if I wake up, I can tell whether or not I've had a decent night of sleep. And then the Oura Ring kind of shows that. And it just kind of helps me guide my workouts more. And I'm not like pushing myself to do a high intensity workout if my body is just not feeling it. So it can be great for that. And also another cool feature is that you can link it up with this app called Natural Cycles to know what phase of your menstrual cycle you're in. So it's a great tool for females. But yeah, I just feel like overall it has a lot of cool data that you can see over time, which is awesome. And then another device that I think does a lot of similar metrics is what's called a Whoop. It's again very similar to the Oura Ring, you just wear it on your wrist. But I like the ring because it's not as bulky, and especially at night, I just don't really like to wear a watch, so I prefer the ring. But anyway, fitness trackers are obviously a great way to check your vital signs on a consistent basis without thinking about it, especially if you do love the data. But I just wanted to highlight that there are ways to track this stuff without a device and just put a meaning behind what the numbers mean. So hopefully you found this useful, and yeah, hope you all have a great rest of your day. And as always, comment any questions or concerns you may have. Thank you. Here is your step-by-step guide on how to take blood pressure. First things first is you're going to need a blood pressure cuff and a stethoscope. I will link some recommendations below. Or you can buy an automatic cuff. However, I personally don't think those are as accurate, but still good to have on hand if you don't have anybody to help you take your blood pressure. So unfortunately, you cannot take your blood pressure yourself. You could try, but it'll probably be quite complicated. So grab someone to practice with and have them seated facing you. Place their left arm up on the table, and then you're going to place the cuff around their left bicep. Make sure it fits snug. Feel their pulse like we did earlier for the heart rate, and make sure the dial on the pump is closed so that the cuff will actually pump up. Then you're going to pump the cuff up until you can't feel their pulse anymore. So for example, if you stop feeling the pulse at 130 millimeters of mercury, you will pump the cuff up to 160 millimeters of mercury when we do it again. So now at this point, you're going to deflate the cuff by unscrewing the valve and reset. So before you reset, make sure the valve is at 0, put the stethoscope on your ears, and then place the end piece in the crease of the elbow with good pressure underneath where the cuff lies. Again, make sure the valve is closed so that when you pump the cuff up, it will actually stay inflated. So now we've got our 160 millimeters of mercury we're going to pump the cuff up to. Once you get to that number, you're going to slowly start to release the valve. Very, very slowly. Don't just let it all air out because then you'll have to restart. So eventually you will start to hear a beat. The first beat you hear is the systolic number or the top number like we discussed earlier. Then keep slowly releasing the valve until you hear the last beat, being the diastolic or bottom number. This takes practice, so don't get frustrated if you don't feel like you can't hear anything on the first try. I will definitely post a video on my Instagram for a visual as well. So to reiterate, even though you pump the cuff up to 160 millimeters of mercury, you may not hear the first beat until, let's say, approximately 125 millimeters of mercury. And then the last beat you may not hear until 75 millimeters of mercury. And we would know that this is around average of a normal resting blood pressure. And again, please note that this will increase after exercise or any of the other things I discussed beforehand. And if you feel like you couldn't hear it on the first try, that's totally okay. But it is recommended to wait at least 5 minutes before you try to attempt to pump the cuff up again around their arm. And lastly, make sure that their feet are not crossed and flat on the floor.